Welcome to the Veterans View Show, and I'm Leroy Davis, your host, and I'm here today with Dr. Booth and Mr. Coleman. Dr. Booth, introduce yourself to our audience, please.
I'm Laquita Booth, and I'm project lead for the Vaccine Equity Initiative, which is through Enrichment Services, a community service agency in Columbus, Georgia. And we are servicing 3 counties, Russell County, Stewart County, and Tolbert. And we are encouraging individuals to get vaccinated. We want to increase the number of vaccines that our adult population is actually receiving.
Well, that's great. And Mr. Coleman, tell us about yourself and who you work for.
Okay, my name is Cordell Coleman. I'm a public affairs assistant at Valley Healthcare Systems, where we service multiple counties here in our Valley area, where we offer multi-specialty comprehension health care. We provide pediatric, women health, vision, pharmacy, family practice, dental service, as well as behavioral health service, in which we also have a school-based clinic here currently in Columbus, Georgia, and hoping to open up multiple ones. My position is to go out into the community, find out what the community needs, and see how we are able to assess those areas that where they need help, such as using our mobile units. We have a vision mobile unit as well as a dental and a medical mobile unit. This allows us to travel into multiple counties, places where people can't get up and make it to see their doctors, so this allows us to get into those areas.
And that's the purpose of our show today. We're talking about a health fair wellness, a health wellness fair that we're bringing here on April 29th. It will be at Russell County High School. And the reason we have Dr. Booth and Mr. Coleman here is because we want you all to understand that this is a program really that started by the ENI, the Equitable Neighborhood Initiative over in Alabama. And what we are trying to do is create a listing of where everybody can go to get medical care. We want to identify everything in the Chattahoochee Valley that can provide health care to the citizens of the Chattahoochee Valley. So you have just enlightened us on what Valley Healthcare does, and Dr. Booth, you told us about your vaccine, but tell us a little more about the shots, if you get the shot, and what you are going to give them on the gift card.
Okay, well, for us, we have 3 mantras: vaccines are safe and effective, vaccines save lives, and vaccines save money. But it's so hard to get that message out. So what we've done as incentives is last year we gave a $50 gift card to anyone who got their first and second vaccine, COVID vaccine, and $25 for a booster. But since April is National Minority Health Awareness Month, we have now doubled that. So anyone who comes to get a COVID vaccine in this month, in April, will get a $100 gift card to Walmart for the first and second vaccination, and a $50 gift card for a booster. So we're really excited about that, and we hope this can bring more people out to events like yours.
Thank you. And Mr. Coleman, you talked about, can you tell us what Valley Healthcare will be bringing to the health fair?
Yes, sir. We're planning on bringing 2 of our mobile units, which is our dental mobile unit as well as our medical mobile unit. And one of the things we'll be doing with our medical unit, we'll be doing blood pressure check. We have this blood pressure initiative thing going on in our community where we provide these meters, and these meters allow us to track your blood pressure no matter where you're at. It's sending us a signal directly from your home, directly into our system, to a point where we're able to call and say, hey, did you take your medication this morning, or what's going on? One of the things we want to make sure we educate is about hypertension, because some of us, we don't know nothing about it. We keep eating all our crazy food, blood pressure going up. We don't know why our head is hurting, why we seeing dots. So we're doing a hypertension initiative. Alongside of that, if needed extra help, our unit also have refrigeration where we're able to transport vaccine and give vaccine. We'll be also able to do simple eye exams or other health checks, simple health checks when we're traveling with the health fair. Now with our dental unit, we'll be able to do basic dental care just to get the basic information to find out what's going on with your mouth. You know, if we practice prevention first.
Right.
First, that's the first step. If you know how to save your teeth, you'll do all the necessary steps to keep your teeth saved. If not, then we can help you with the next step, where crowns or partials or whatever you may need. So with our dental unit, it's a big unit where we're able to house 2 dentists at the same time, and we're able to see multiple amounts of patient at the same time too.
Okay, well, that's great, because people need to understand that when they go into that dental van, that they're going to, so the doctor can tell them what they need done. And they're not actually going to get the teeth pulled or anything of that nature, but actually to get the preventive care and say, hey, this is how you need to take care of yourself. And basically the same thing with medical, right?
Yes.
Okay. Dr. Booth, is there anything else you'd like to share?
Well, I think that vaccines have to be seen as a part of general health care. You know, in the past, we had looked to vaccines to do things like to help with polio, and we had a discussion about this earlier. But there's been so much misinformation out there about what vaccines do or perhaps what they don't do. And I think it's important that people realize when you're talking about your general health, whether that's, you know, getting screening for blood pressure or the other things that we do, then vaccines are just a part of that. And we have to start talking more about that.
Right. And you know, I'm so glad that we're able to partner up, because by partnering up, and we're this the Equitable Neighborhood Initiative, it allows the citizens of the Valley to know exactly where their health care is and where you can go. And back to you, Mr. Coleman, this is Valley Healthcare is good for people on both sides of the river.
That's correct.
And tell us something about your insurance or how you accept it and what you all do.
Now, with our insurance, we currently accept all insurance with the exception of Friday. That's the only type of insurance we don't accept. But that's not enough where you can say, well, I can't go there because I don't have insurance. That's where sliding scale fees comes in, where you can still be able to be seen, or payment arrangements can also help as well. And this ties into even with our pharmacy. Just because you don't make a certain amount of money, we can't just deny you your medication. We have a patient assistant program called PAM that allows you to have assistance with your medication. We even got this new cool device now where it's talking scripts. And with these talking scripts, it's designed for the illiterate and the blind. So if you go to your doctor, you get your medication, you don't know what pills you're operating with. But the talking script lets you know what your prescription is, how many pills you got left, how many refills you got left, who's your provider. And those help also the people that are blind or just can't read. Some of us know about medication, but we have no clue what our medication is, especially when you're illiterate. You don't know, but this talking script allows that to happen for them.
I think that can help all of us.
Oh,
Because a lot of us just simply forget, and we just don't have that information at hand.
yes.
So I think that's wonderful.
It's wonderful. And also, let the veterans know as well that you accept TRICARE.
Oh, yes, we accept TRICARE as well, yes.
And I have one question about the TRICARE. Now, TRICARE don't go towards dental.
This is true. But there's still hope for that, because we have an outreach program that can schedule you with some form of insurance where you can get those dental services done. And once again, if you can't get those particular insurance, we can still get you on with a sliding scale.
Okay.
And the sliding scale will help tremendously.
Okay, that's great.
You know, Mr. Davis,
Yes,
one of
ma'am.
the things that I did want to mention, although I talked about COVID and COVID boosters, if there's any type of vaccine that a person needs or we can identify, we can help with the cost of that. A lot of the people that we see, especially in the rural areas, they don't have insurance. And instead of giving them an incentive, we might as well just pay for the vaccination. So that's another service that we can offer through our Vaccine Initiative Equity Program.
Well, that's great. You see what happens when you partner up with people?
Yeah, that's
You're able
awesome.
to do more for the people in our valley. And I just want to say again, for the ENI, the Equitable Neighborhood Initiative, we are happy to partner up with you all. And I spoke with a lady this morning before I came in, and she talked about how happy she was with Valley Healthcare. So they pulled her teeth and everything, and she didn't have any money, but y'all pulled them anyway. So that's telling you people out there in our community that we have the best things here to offer you, but you just got to go out there and talk to them and get it and not be afraid.
You know, we're really excited about your event, and that's going to be April the
29th.
29th at Russell County
High School.
Yeah.
And it's going to be from 10 to 2. Now, we were going to do hamburgers and hot dog, but one of the social workers said, this is a health fair. So we're going to do fruit and smoothies. So we're going to make it healthy. So it's a health fair, so we're going to make it healthy.
That's great.
And the setup time will be from 8 to 9, and we're going to kick it off at 10. And guess what we're going to do different than what others been doing for health fair?
What's that?
We're going to have ROTC present colors and open up with a prayer.
Oh, that's awesome.
So
And I understand too, you're going to have some high school students there.
yes, we're going to have some high school students there, and may even have the ensemble band just play a little music while people walk around.
But I think it's great too that young people will start to see the value of some of the preventive medicines we're talking about, but also the value of vaccines and the value of health in general.
Right, and to know where to go to get that health care. That's what most important. I didn't know that Valley Healthcare offered all of the services that they offer, but now I'm not going to stop talking about it.
Thank you.
Yeah. So that's it, and I'll see you guys on the 29th.
Awesome. Yes.
Looking forward to it. Thank you so much.
All righty.